webinar. So that's a bit of a disclaimer as we move into the webinar today. So this webinar is really going to provide you with an overview of data on providing you with additional learning resources so that you can support more depth on the topics that are presented here today. We did develop a resource guide that accompanies this particular webinar, and that resource guide has a ton of references and online resources so that you can continue your learning on a wide range of these topics that are going to be presented. And before we get started, I do want to acknowledge Mr. Alex Denning. He has been supporting the development of this webinar and was directly responsible for creating this resource guide and finding all of the extra resources for you all. So we'll be sending that out to those that are registered as soon as this webinar is concluded. Next slide, please. So first I want to just open up. I like to start these sessions with some learning objectives so that you know what the focus of this webinar is going to be. Here's the things that I'm hoping that you're going to understand through this session. The first is to be able to just kind of generally define what is data analysis, what does it mean. It's also important, I'm going to go into quite a bit of depth and give a couple of examples on the general process for analyzing both qualitative data as well as that general process for analyzing quantitative data. And then we're going to define some really important topics that relate to data analysis, like reliability and validity, and we'll go into quite a bit of depth on this. So first, I also wanted to let you know that there will be quiz questions that are presented throughout the webinar. Please take some time to respond to these questions, as it will definitely support your learning through this course. Next slide, please. So what does it mean to analyze data? Data analysis is really that process of taking raw data and turning it into something that's usable. There's many ways that data can be presented so that people can see it. It could be in the form of a report, it could be graphs, it could be charts, it could also be what are called word clouds. Next slide, please. So I'm going to give you a few examples. This is a graph that came from UIHI. And as you can see, the data from this particular project, which is looking at patients in the diabetes registry for the urban Indian health organizations, you can see that they're looking at the total number of registries, which is the red line, and the number of patients that were audited as the yellow line. And they're actually even putting that data at the bottom and giving you additional information into this chart. So this is just one example of how data can be put into a picture form so that you could use it to educate and understand what's going on. Next slide. And here's a picture of a pie chart. So this also came from the Urban Indian Health Institute. And as you all may be familiar with this actually shows the distribution of the types of urban Indian health programs. So in this pie chart, you can see that, and pie charts are nice when everything equals up to 100%. So you've got 100% of urban Indian health programs, and 11.5% of them are outreach and referral, and so forth and so on. So this is another example. Next slide, please. And finally, I wanted to show you an example of a word cloud. A word cloud is a way to present qualitative data. The first two are much more likely to be used when you've got quantitative data. But the word clouds are nice because it does allow you to show words, phrases, and other things that may come up when you've been coding qualitative data. And the size of the words help show kind of the frequency or how often those particular words came up. So these are great tools to use with qualitative data, as they can quickly and visually show the words that participants really said the most. Next slide, please. So I'm hopeful that you all have been on the previous UIHI webinars. If you have not, I highly recommend you go back and review those webinars, and I think it will help make some of these things make a little bit more sense. So the first two webinars that UIHI did, the first three really focused on things like describing the problem, creating your research question, and then developing the tools and methods that you're going to use to collect the data. These are really important pieces, and if these three things aren't done well, then you may have some struggles in the data analysis. So it's important that you have a good solid methodology, a good solid plan and design, and you have a clear logic model, and you know how you're going to be supporting your local evaluation work. So once you've really developed the logic model, you have a good understanding of your methods, you know what tools you're going to use, then you actually have to collect that data using those tools and methods that you selected. Data collection could be a wide range of things. You could use surveys. You could use assessment tools like the PHQ-9 or the Beck Depression Inventory or some of these other tools that are standardized that are out there. You could also use structured interviews, and there are some studies actually can use observational data. Now, a word about observational data, if you really want to make it, you want to firm it up a little bit, then you would have some type of observation form that was standardized that you could follow every time you made an observation. So you were following and asking yourself maybe the same kinds of questions, or you're looking for the same things across multiple points in time. So these are all examples of how you could collect data, and some of these could be quantitative data, and some of these may be qualitative. But as you're preparing to analyze your data, one of the very first things that you're going to be doing is developing a database file in which you can aggregate all that data. And we'll be talking a little bit, and I'll show you some examples of some database files as we get into a little bit more into the weeds around these topics. But I've put on the slide a few examples of some of the databases that people often use. These are just a few of them. There are others, but these are some commonly used ones. So, for example, the SPSS in Excel, Microsoft Excel, is usually pretty good for aggregating and analyzing quantitative data. There are other types of databases like SAS, other software that researchers use, so these aren't the only two. Excel is pretty basic, but it can get the job done for a local evaluation that's not too complex and uses, doesn't use very complex statistics. And the nice thing about Excel, a lot of the programs end up using that for aggregating and analyzing data because it's already on a lot of your computers, because most of the programs do use Microsoft Office, and Excel is included as a part of that. Now, the last two are, one is Access, and that is also a Microsoft program. The other one is Atlas, and these are databases, software that's used for aggregating qualitative data. So it can actually form all that rich description and help you organize it and analyze that data. Through Access, it is Microsoft. It's not usually included in your standard Microsoft Office package. So if you did have a lot of qualitative data and you thought it was really important, you might have to purchase some type of software for the qualitative data piece. Next slide, please. So before we get too far, I just want to make sure that everybody knows. I've been throwing around some terms already, and I just want to make sure everyone knows what those terms mean. So the first is data aggregation. This is really the first step towards analyzing data in that you're combining all the individual data by each variable so that it can be analyzed across the whole group of participants. And once you aggregate the data in one place and space, let's say in an Excel database, then you can run the statistics across all those data points. Note that the data points could also be observations and other qualitative information. So data points doesn't have to be, a number. It could also be a phrase, some words, a description, or those things. Next slide. So I've also started using this term variable, and I want to make sure that everyone understands both when you're aggregating data, you're aggregating it according to variables, and that everyone understands what it means, what a variable means. So a variable is really a characteristic, a number, or a quantity that can be measured or counted. There are several types of variables, and it's important to know what type of variables you have in your data set, and this will help you determine what type of statistics that you can run on that data as you're working on data analysis. The first thing is I'm going to review the different types of variables, and then later I'm going to help you understand what types of statistics you can run based on each of these types. So the first is a categorical variable. And categorical variables are often called nominal. So you'll hear them called nominal. And nominal means name. So it's like a category. You're either male or female. You either live in an urban area or you live in a rural area. There are things that could be categorized in some way. Ordinal variables are those variables that are in a sequential order, like grades in school. So you're either in first grade, second grade, third grade, or so forth, and these increase in sequential order as you move through your grades in school. An interval variable is kind of like ordinal, but the interval variable assumes that there's equal distance between the points. So, for example, temperature is a great example of interval variable because we assume that the difference between 50 degrees and 51 degrees is going to be the same as the difference between 51 degrees and 52 degrees, and that those are equal, the distance between those data points. I'm going to talk a little bit about the Herth Hope Index here in a bit. We're going to use it as one of the samples so that you'll kind of see that, but a lot of your assessment data that you'll collect could be considered interval variable, particularly if it doesn't have a true 0 point. And that's really the difference between the interval variable and the ratio variable, is that with ratio, it's just like the interval, but you have a true 0. So income, you could make no money. Blood sugar, you could, drop completely down. Now, I don't know what that would mean for your health and, well-being, but those things could have true 0 points. Next slide. So in addition to understanding the different types of variables, it's also important, particularly in inferential statistics, and we'll talk about that in a minute, it's important for you to understand if the variable is considered an independent variable or a dependent variable. An independent variable is a variable that you or nature manipulates. So, for example, participating in a new treatment program. So there are ways in which an independent variable can be set, but nature controls it. So let me give you an example of what that might look like. An example of an independent variable that is controlled by nature could be something like depression. You, as the investigator, can't control if someone's depressed or not. Nature does that. So when nature controls a variable, researchers will refer to this as what we call quasi-experimental study, because there are some things that you as the researcher can't control. In other words, it's not true experimental because you're not truly controlling everything because you can't dictate whether or not someone has depression or not. Therefore, it's usually not considered true experimental unless you yourself as the investigator are manipulating some type of variable yourself, like whether or not someone receives a treatment or not. A dependent variable, then, is the effect of that independent variable, like the data you collect from the participants that are in the program. So the dependent variable could be like their level of hope for the future, and you might have a tool that you're collecting, and that data becomes then your dependent variable because it's the effect of the independent variable. So let's assume that you're going to implement a new treatment that helps people with depression. And what you decide to do in this new treatment is that you're going to add yoga and mindfulness to the standard treatment of depression, which is typically a cognitive behavioral therapy, which people shorten to call CBT. Some of you may have heard of CBT. So let's assume that you've got these two different groups. One group gets CBT only. The other group gets CBT plus you give them yoga and mindfulness support. So let's say that we give all these participants, we assign them, we give all the participants in both of these groups the Herth Hope Index. We do it before they start their treatment, and then we do it when they're done. When we give the Herth Hope Index before the intervention, this is called the baseline data. So you're collecting baseline data. When we give it to them after the intervention, it's usually called a post-assessment. Sometimes people refer to this as pre- and post-testing. But when you do this, then you can look at the differences between the two groups at the end using statistics. So you can look at, did those that receive the additional components of yoga and mindfulness have better outcomes or more hope for the future than did those who only received the CBT. Now, in this example that I just shared with you, because you're controlling, as the investigator, which group you're going to put these folks into, if they're going to get treatment as usual or they're going to get the added enhancement, then this would be considered what we would see a true experimental design, because you are, if you use random assignment and there's some other factors with that, random selection and random assignment into those groups, then you would have what we would consider a true experimental study to support your ability to make references to whether or not yoga and mindfulness really does make a difference. Next slide, please. So there's two types of, we already talked about there's two types of data that we can analyze, qualitative and quantitative. Qualitative data is really a way of capturing and recording the attitudes and feelings of folks. So, for example, if someone said, "This webinar is great," and they just say that as a statement, that would be an example of qualitative data. Quantitative data is data that is expressed in some kind of numbers. So 9 out of 10 people agree that this webinar is great. And we'll go into a lot more detail in the next few slides about these two types of analyses. Next slide, please. So we're going to start with qualitative analysis. But before we do, I want to bring some acknowledgement to one of the community projects that I've had just a real honor to work on. The photo you see on the slide came from the Fresno American Indian Health Project, which is one of the urban Indian health programs. And what you see in the photo is a real session of coding qualitative data. And all the participants that you see in the photo are local community members. They're all parents, uncles, aunts, grandparents, and none of them had had any formalized training and evaluation before we taught them how to code the qualitative data. So I want to bring this to your attention because it's important that we acknowledge the critical role that your communities will play or can play in supporting your local evaluation. Not only can they bring kind of a human resource to what you're doing, but they can also improve the reliability and validity of the data, as there are a lot of challenges in coding qualitative data if you are not from that community and familiar with the local community language and context. And in this particular community, we trained community members to code the data, and they spent literally days working on this as volunteers. So they do, bring that human resource. So, I think it's important for us to acknowledge the role that your communities can play, and you can learn more about this by reviewing some of the archive presentations that I've supported as a part of the Substance Abuse and Mental Health Services Administration Tribal Training and TA Center. They actually have a learning collaborative on evaluation, and we've been running sessions on that, so you should be able to access some of that if you're interested in learning more about community-based and participatory approaches to research. Next slide, please. So I want to start now with qualitative data. Qualitative data, again, is data that's expressed in those descriptive terms. There are a number of examples and sources of qualitative data, and you can see what some of those are there. You may not have heard of photo voice before. It is a pretty youth-friendly, although they've used it with adults as well, but it is a method for kind of like a focus group, but it uses pictures and descriptions of those pictures instead of, just asking a question. It allows participants to go out and explore their world and answer questions with photos, which really tends to be a pretty good youth-friendly approach. Next slide, please. So analyzing qualitative data really requires an examination of the themes or patterns in the data. There are a number of theoretical approaches to analyzing qualitative data, but all of the methods usually include some type of coding of the data into various themes, categories, or subcategories. Codes can be based on things like, recurring patterns or themes. They can be ideas or concepts, terms or phrases, or even keywords. Next slide, please. So what I'm going to do now is give you an example of what might be a typical qualitative analysis project for a local program. And so what I'm going to do is I'm going to walk you through an example of a process evaluation. Many of you probably heard of process evaluation before. It's oftentimes written into many of the grant applications that you have to, to complete a process evaluation. But a process evaluation is really assessing the program process. How well are you implementing it? How well are you delivering the services? Are those services effective? Are you efficient? And that data, the process evaluation, is generally used for continued quality improvement. Next slide. So in this example for the process evaluation, my typical approach in conducting these evaluations is to have local program staff documenting their work on the ground by using a pretty strict activity form. So that's the one you see on the screen. It's been changed a little to protect everybody, except my name is still in there. But this is a modified version of the project report form. And as you can see, the event of this particular project, it occurred, it tells you the date that it occurred. And this particular project is coding evaluation. And this is where a team of local community members, kind of like in the picture you saw a few slides ago, actually come together to code the qualitative data that they collected as a part of a local needs assessment. And you can see how this collects a lot of different information. Most of it's qualitative, although some of it is quantitative. So you can still have some quantitative data in a process evaluation, but a lot of it ends up being very qualitative. So as you can see, the report documents a number of data points, and for a project, staff may generate hundreds of these report forms within 1 year, and we as the evaluator then have to go in and try to aggregate and analyze all that data to determine the effectiveness, efficiency of the program, and what quality improvement pieces need to be moved forward so that the program can continue their growth. And each of these activity reports would be coded for themes and sub-themes and then would be organized in some form of database so that all the data can be examined together. Next slide, please. So now you'll see how we took that data and entered it into a database. So in this particular slide, we actually aggregated the data using Excel. And again, remember, Excel has some limitations in that you can organize your qualitative data there, but it's really tough to analyze the qualitative data. But if you don't have a lot of it, Excel might be a good way to organize it, and then you can just code that stuff manually. And the reason I say that is because, again, if you want a qualitative database, a software, you're probably going to have to purchase it separately. If you've got a lot of qualitative data, it might be worth it. But if you don't, then you can still organize the data using something like Excel, and then you can do that analysis more manually. So as you can see, the one that's highlighted there, 2-5-15, this was the event, the subcommittee that I just showed you on the activity report. I gave a little summary, and then it's a theme and a sub-theme. So we identified this as workforce development because we were actually building skills of local community members so that they could, learn how to do some of these things, how to aggregate and analyze data. And then also community participation was the sub-theme because in addition to raising up their skills, we're also bringing community members into the project so that they have some participation in the work of that project. Next slide, please. So here is an example then of how we've got the data. We had the database, you saw that on the last slide, where we literally enter in every single activity report for the process evaluation. And here's an example of how we went through manually and really summarized what were those major themes and kind of counted them, so to speak, in frequencies. It's important to note that some researchers choose not to turn qualitative data into anything quantitative, as you see in this slide. And there is some disagreement in the field around whether or not qualitative data could be turned into quantitative data, as you see here. However, I typically do get some kind of frequency count on the various themes of the qualitative data because it helps me really see what are those themes that are rising to the surface most frequently in the program. And then I will prepare a written narrative that describes in a lot more detail the range of activities that occurred around that theme and making sure to highlight any of the program successes, challenges, barriers, or needs for growth and quality improvement. Next slide, please. So here's another example of how we took data from the last slide and we put it into some type of graph that folks can take a look at and see it in a picture form, and you saw some of those examples of graphs before. But here you can see that the majority of their time in terms of all those activity sheets was really focused on trying to bring up the workforce and develop the workforce. And they were also working to develop their programs, and you could see things like community participation and other things are also occurring at pretty frequent rates. Next slide, please. There are some limitations to qualitative data and the analysis of that data. First is with qualitative data, usually there are fewer people studied. Now, this isn't the case. Let's say that you decided we're going to do a needs assessment and we're going to send all these surveys out there and we're going to get 200 participants, and in that survey you've got some open-ended questions. Well, technically that's considered qualitative data. So if you've got qualitative data embedded into something like a survey and you're collecting a lot of large numbers, then you might have a lot of qualitative data. And I've had experiences with that, particularly on things like community needs assessments or other things. But typically, you know, if you're doing a focus group, you've only got 6 or 7 folks in there. So fewer people are studied, which means that it's less easy to generalize. Are you certain that those folks that participated in your focus group are a true selection of the diversity in your community? I mean, these are questions that you have to ask yourself when you think about how you're going to use qualitative data and what kind of inferences you're going to make from it. So there are some limitations to this. And it's difficult to make systematic comparisons because you can't just compare 2 numbers and run the stats on them to see if they're, you know, statistically or clinically significant. And so it makes it a little bit more difficult to make those systematic comparisons. And it's really dependent upon the skills of the researchers and coders. Some can do very deep coding where they're really getting some of the nuances in the data. Some may not do that deep of coding, and you may not have as much rich data that comes out. And particularly when you're using like local community members to help with that coding, there's a lot of training and supervision that has to go along with those things. Next slide. Okay, so now we're going to move into quantitative data. And I want to direct you to the photo on the slide because this was taken also from the Fresno American E-Health Project, and I wanted to highlight this because it's very creative ways and very youth-friendly ways of capturing quantitative data. And you can see in this particular example, and this is an actual event that occurred with youth, and you can see all the little glass beads on the right. So what youth are able to do then is to rate using a Likert scale. Instead of numbers, they get to put their bead in whatever jar it makes the most sense for them. So I wanted to point this out because, you know, this is really an exciting way to kind of think about youth-friendly forms. And I always encourage the programs to really engage your youth in developing any assessment methods and protocols that would be used with them because they'll really make sure that you get it right and that you do it in a way that makes sense for them and that they understand. And really it does improve the reliability and validity of your work, I think, when you engage those young people in the development of how you're going to assess their experiences. Next slide, please. Okay, so quantitative data then is different from qualitative data in that it is expressed in numbers. And you can see a number, all the sources of qualitative data that you might be able to collect. And this is just a list of some. There are probably more. Next slide. So if you will remember back to the slide on the different types of variables, you'll see them presented here. Remember, nominal is also the same as categorical. Some people call it a categorical variable. some people call it a nominal variable, but it's pretty much the same thing in that you can clearly categorize something or name it. You're either male or female, you either live in the city or you live in a rural area, maybe you live in a suburb. There are categories that you can develop. The ordinal variable, remember, is the sequential order. So things like grade in school. The interval variable, again, is like the ordinal variable, but there's an equal distance between the data points, like the Herth Hope Index. We assume that if you score a 20 on the Herth Hope Index and someone else scores a 21, that there's an equal distance between 20 and 21, just like there would be between a score of 21 and 22, that those are all equal in between the data points. And then finally, the ratio variable, again, is like the interval, but there is a true 0 point, like temperature. And so as you can see here, depending upon whether or not, what category they're in, there are certain types of data that you can collect and certain types that you can't. So let's take nominal as an example. Would it make sense for you to estimate the mean or average of gender? Probably not. So there's the example of a nominal variable, which is male-female, and it wouldn't make sense for you to determine what's the average on this, because you either have so many number of males or so many number of females, and there's no way to figure that out in between. And then at the bottom, you'll see that I've added one other categorization to these variables, and it's categorical or continuous. And we'll talk about these specifications when we get to talking about inferential statistics, because it does make a difference. Next slide, please. So there's two different types of statistics that you can use when you're analyzing your data. The first is what we call descriptive statistics, and it's pretty simple, just like it is in the name. Descriptive statistics describe your data. How many males did you have? How many females did you have? What was the average income of the participants that were in your treatment program? These are examples of some of the descriptive statistics that can be used. As you'll see on this slide, as well as we'll show on the next slide, there are a number of descriptive statistics that are pretty common, and you may have need to use these. The first is mean, which is really the average, and that's how you sum up all the values and you divide it by the total number in the set. And I give you an example there. The next is median. That's the middle value. It separates the higher half and the lower half. So in this case, the median would be 3. The mode is the most frequent value in a data set. So as you can see on the example, the mode would be 2 because 2 occurs most frequently. Next slide. We also look at things like variance and standard deviation. These two are very related because variance is just basically the square root of the standard deviation. And what these two things tell you is how spread out the scores are in your database. And that's important because let's say that you're implementing some type of intervention and you get an average back, but wow, you've got kids that are just all over the board. If they're all over the board and you've got a wide range and you've got a lot of variance in your data, then you might have some challenges in, feeling comfortable that that data is reliable. And we'll talk a little bit about, we'll have a word about standard deviation towards the end of this presentation. But it is important to look at standard deviation because it tells you how varied your scores are. If you've got a situation where, let's say on the Herth Hope Index, it ranges from 12 to 48. Those are the number range. So let's say that you've got pretty much all your kids are clustering around 40. You're like, wow, all these kids are clustering around a score of 40. But let's say in another data set, you've got kids that really run the gamut from 12 all the way to 48. It's going to be a little bit tougher for you to consider that your data is reliable because they're just spread out all over the place. And so it's really important that we look at these things. And then finally, the range could be important for you as well, and it's really looking at the difference between the smallest and the largest values. Next slide. So in addition to, I told you there are two types of statistics that we can run. The first being descriptive, so you describe your data. The second is what we refer to as inferential statistics. Inferential is really in its name. It means that it's a statistic that helps you draw inferences or conclusions about the data, such as treatment A is better than treatment B. You can't really do that with descriptive statistics because you're just describing the data. But this type of statistics will actually allow you to see if there's something unique occurring that helps you make some kind of conclusions for the work that you're doing. And I talked to you about the other ways to identify variables. We've talked about the different types, including nominal, ordinal, interval, and ratio. We've also reviewed the difference between independent and dependent variables, which, again, I told you would be very important when we're looking at inferential statistics. But there's also variables, as I shared earlier, that are categorical or continuous. Now, this is an important distinction for determining what type of inferential statistics you would use. Categorical means something that can be clearly put into a category, like whether or not someone is depressed. Continuous is something that's not in a category, but rather on a continuum, like the Beck Depression Inventory or the Herth Hope Index. These measures tell you the range of where someone falls on each of these constructs. Next slide, please. So I'm going to give you an example of one of the forms. Actually, could you go back? Let me just make one more comment about that before I move on. With the inferential statistics, let me just give you a quick example so you kind of know what this means. As you can see from the slide, the designation of a variable as either categorical or continuous will really help you know what kind of inferential statistics you can use. In example 1 that's presented at the bottom of this slide, let's say that you have an intervention that serves as the independent variable, and you want to know if males and females experience that intervention differently. In this case, you have two categorical variables, male, female, and the most appropriate statistic would be a chi-square. In the second example, let's say you have a new intervention, such as adding yoga and mindfulness to CBT. Remember, that would be your independent variable. Which treatment intervention do they get? And now you want to know if people that receive this new intervention do better in increasing their hope for the future, as do those that that get the treatment as usual, which in this case is CBT by itself. If you look at the slide, you will see that having one categorical variable, which is the intervention compared to treatment as usual, and one continuous variable, such as the Herth Hope Index, then you would use a t-test. So chi-squares and t-tests are probably the most common inferential statistics that are used in local evaluation, and particularly for programs that don't have complicated models or designs and that aren't involved in some type of research project. Next slide. Okay. So getting back to chi-square, so now that we've reviewed the types of inferential statistics that you're probably going to use in program evaluation, I'm going to provide a little bit information about what these statistics actually do. So chi-square is used to determine if two categorical variables are different from one another. So for example, do males and females differ in their choice of treatment? So as you can see here in this slide, 250 females preferred home-based treatment and 150 preferred clinic-based treatment. For males, it was the opposite. So by eyeballing this, it looks like there might be some differences between males and females on their treatment preferences, but we will run a chi-square to determine if these groups are indeed statistically significant. And there are ways to run chi-square in Excel. So I'm going to review a little bit about significance and some of these related terms later in this presentation, so hold tight on that conversation around significance. Next slide, please. And then the other way that you might analyze data using inferential statistics is a t-test. And it can be determined, there's many different types of t-tests that you could run, but they're generally going to fall into a couple of categories for most of your local evaluation projects. The first is what we call an independent t-test, and that means you have different groups. So in the example that I gave you where you had all these depression patients and you're randomly assigning them into two different groups, one they get the yoga plus mindfulness and CBT, the other one they just get CBT. That would be considered independent t-tests because those are two different groups of people. But a dependent t-test is when you have the same group of people. So, for example, if you do what's called pre-post testing, we talked about that a little bit, and it's all the same people that you're collecting data on. You're just getting their baseline data, and then you're seeing whether or not they made any change over the course of your intervention. In that case, you would use what's called a dependent t-test. And there are resources in the resource guide that will help you learn more about calculating t-tests. And, of course, you can always ask for technical assistance from UIHI and other TA partners that you have. Next slide, please. I'm not going to spend a lot of time on this slide, but there are what we call higher order statistics that researchers will use, but these really require some very advanced training in research design and statistics. It's not something that you would do for a local evaluation unless you probably had some very highly trained quality researchers on board. And I did include a brief review of a couple of the most common statistics just so you have a greater understanding of the depth and complexity of this topic. But as you can see, an ANOVA is what's typically used when you're comparing categorical independent variables with 3 or more continuous dependent variables. So remember, with a t-test, you have to have 2 or more. You can only have 2 groups. So ANOVA allows you, let's say that you had 3 interventions, you're like, we're going to look at what's the difference between people who get CBT only, those who get CBT and the extra enhancements of yoga and mindfulness, and then we're also going to compare them to the waitlist controls, people who've not even come in for treatment. That would be an example of when you would use an ANOVA. A regression is it's pretty much the same thing as an ANOVA, except that it analyzes data on a continuous basis rather than on a categorical basis. So an example would be looking at the difference or the relationship between age and hope, because maybe hope improves as we get older, or maybe it drops in certain times and stages in our life. Maybe it drops during adolescence, maybe it drops during elderhood, but a regression would help you look at the changes across variables in a more continuous fashion. Next slide. Okay, so let's now go into an example of qualitative analysis. And this is something typical that you might have for your local evaluation. Let's assume that you have a pre-post assessment, and you're going to give this to youth before and after a culture camp. And you want to see if that culture camp improves the kids' hope for the future. Next slide. Here's an example of a completed Herth Hope Index. And this is for one individual. This data has to be scored and entered into a database so that the statistics can be run on this data. Note that it's really important that you check and double check your scoring, because if there's any scoring errors, then it impacts the reliability and validity of your data. In this particular case, a lot of tools use reverse scoring items. So you'll see those 2 that are circled in red. These are the 2 reverse scored items in the Herth Hope Index. So make sure you're really thoughtful and make sure that you're, really know how to score these tools and that you're doing it correctly, and that if there are any reversed items that you're making sure that you capture those. Next slide. Okay, so as you can see here, these are some of the data points that you might be collecting, what we would consider the variables that you would be collecting. Let's say that you have 10 youth that completed the Herth Hope Index. You also want to make sure that you have the important demographics you need, like how old are they, what's their gender, or other important descriptive variables, so that you can actually learn more depth about the data. Because, for example, you might find that culture camp does well for younger youth, but not for older youth, or vice versa. You have to make sure that you ask these demographic questions and that you can actually match that demographic data up with the outcome data. In this case, you want to make sure that you can match the demographic data with the Herth Hope Index. Next slide. So here's an example of how we took that raw data and we moved it into a database like Excel. So as you can see, each participant is giving a unique ID. I'm a big fan of that because it kind of, if somebody found this, they wouldn't know whose data was whose. And then all of their data is entered across that row. So the data for that participant all goes across that row. So for participant 101, it's a female because we coded the data. 1 is female, 2 is male. So it's a female. She's 16. And then you can see all of her data for the Herth Hope Index is entered by item. So the first is her outlook for the future, then her question, her response around goals and whether or not she feels alone and some of those things. And it would go on as all the variables you have would go across that row. Next slide, please. So now once you have your database entered, then you can really consider how you would analyze that data. So in this example, you would be using what we call a t-test for dependent samples, because these are the same youth that are taking the Herth Hope Index pre and post. So it would be a t-test for dependent samples. Now once we run the t-test, we want to ask ourselves, is this statistically significant? Now what is statistical significance? It's really, you run the stats and you determine, statistically, are these two groups different from one another? Or are these two values different from one another? So for example, in this example, you would say, oh, well, we saw that youth that were in the culture camp had significant improvements in their hope for the future at the end of the camp. So what we're able to say is that youth did statistically significantly improve. Now, there's a lot related to this, and there's a lot of factors that I just don't have time to go into on this particular webinar, but you're really looking for what we call a p-value. And a p-value is your probability of making an error, and you have to set this p-value as a investigator. And in science, the norm for the p-value is usually less than or equal to 0.05. Now, what that means is that you've got a 95% chance you're correct, and you have a 5% chance you might have made an error, or there may be some error in the data analysis, and that you may be concluding something that's not true. So you do have a chance for error. In practice, some people don't want to set that p-value so high, because if you've got a 95% chance you're correct, it impacts your ability to find any significance. And let's say you think you've got a cure for cancer. If you think you've got a cure for cancer, you might want to allow yourself to be 80% correct, because if you do have a cure for cancer and you say, oh, no, it's not a cure, then you might be potentially have, many people that could benefit from your knowledge, but you're not going to publish it, and you're not going to say it's anything significant because there's some kind of error in the data. So the p-value may be adjusted. And again, there are additional references for some of these concepts that are being presented. Next slide, please. I also want to visit with you a little bit about the difference between clinical significance and statistical significance. Just because something is statistically significant doesn't mean it's really significant clinically. And so something can be statistically significant, but in the real scope of life, it's not that meaningful. And there are ways, and we call this effect size. When you're measuring clinical significance, we call it the magnitude of the effect, or your effect size. And there are some online resources to support you in calculating effect sizes, and some stat packages like SPSS also have mechanisms for doing this. Next slide. Okay. So in this example, you can see there was a statistically significant improvement in the youth's overall feeling of hope post-camp, but we have to ask ourselves, is this difference from pre to post really clinically meaningful? Because if you look at it, it's only just a few data points. So if youth are only improving by a few data points, it may not be clinically significant, even if it's statistically significant. Next slide, please. Okay, there are some limitations to quantitative data. The first is that they're numerical descriptions, so they don't give you a lot of detailed narrative. Also, preset answers, especially like Likert scale answers, may not always reflect how a person really feels, but those are the only choices they have. And then sometimes there can be what we call structural bias, which is really kind of a false representation, and the data, it could happen when the data really reflects the view of the researcher instead of the participating subject. It could impact like the way you write a question, the options you give them to respond to could create structural bias. Next slide. So now I want to share very quickly about reliability and validity, and we don't have time to go into a lot of depth about it, but you do have to have some idea about the, at least some attention to the reliability and validity of your data. These are two sides of the same coin. Validity is the degree in which the results can be used outside of that study. In other words, how much can you really validly generalize this, that this is truly what's occurring within the population. And then reliability is being able to repeat a piece of research and get the same findings. So, a ruler is considered a reliable measure of length because every single time you use a ruler, you should be getting a reliable measurement. Next slide, please. So here's an example of reliability and validity and how they kind of go together. So on the first target on the left, this is reliable and not valid. So the participant is hitting the same spot on the target each time, but never hits the bullseye. On the second target, it's valid but not reliable because if you average all the shots, it would average to the bullseye. So it's not really a valid measure because, again, remember we talked a little bit about standard deviation and variance. Look how scattered out those scores are. In the third one, the third target, it's neither valid nor reliable because the shots are pretty random and there's not really a target, and none of them are really at the target. So the fourth one, we would consider that both reliable and valid because it hits the middle of the target, and it's reliable because all of the scores are consistently near the same spot. Next slide, please. So there's a lot of threats that you have to be concerned with because there's threats to reliability and validity in your data analysis. And I've listed a few here. And things like unit of analysis, if it's not clearly defined, can you clearly tell the difference between your variables? Or are there areas of overlap within the variables? An example would be urban versus rural versus suburban. How can you truly know if someone's in a rural area, a suburban area, or an urban area? You have to have clear criteria for distinguishing between those three. Statistical regression to a mean is another one that we see a lot. And really what we know is that over time, people have a tendency, even if they make improvements, they have a tendency to regress to the mean or to the average on any variable. And so this can create a natural threat to validity. And then finally, data entry errors. This is a big one, and I'm going to talk a little bit more about this. Next slide. And your errors could come up in terms of your data itself in your database. And because we're talking about analyzing data, I'm talking to you about how to set up a database. It's important that you know that when you actually enter your data, you have to really make sure that all of that is accurate. And so there's a few strategies, data cleaning strategies here that you would use. You don't want missing values, so if somebody just skips something, you want to put something in there so that it's just not look like it's missing. You also look for spelling errors. You want to make sure there's no wacky scores that just don't make any sense whatsoever. So you're looking at those kind of wacky scores that might be in your database. And then I'm a big fan of doing a 20% random check of all the data that's been entered for errors. And actually, if I see high rates of data in a 20% random check, so I'll go back through every single Herth OpenDex and I'll have some random selection of those actual assessment instruments, and I'll check them to see how they were entered to make sure everything was entered correctly. If I see high rates of data errors, then I would likely go back and re-enter all that data again from scratch, because if you don't have quality, accurate data, then whatever analysis you're going to do is not going to be reliable or valid. Next slide, please. And I talked a little bit about the standard deviation. And you could see that a little bit on the targets when you're thinking about reliability and validity. But if you've got a large standard deviation, that means your data is really less reliable. If you've got a mean of 38, but the scores range 15 points to the 15 points above 38 and 15 points below 38, then you've got a wide range of data. It would probably be considered less reliable than if you had, let's say, a standard deviation of 5 and your data only, only ranged from 5 points above 38 to 5 points below 38. So looking at your standard deviation is important. And again, there are additional resources. Next slide, please. So in conclusion, it's really important that if you have never had formal training on this topic, that you really seek out additional training and consultation in conducting data analysis. It is important that that's being done with quality so that whatever data you're presenting is really helping your community, because if you do have problems with, reliable and valid data and you don't have that, then you could be misinforming programs or misinforming communities, and that could really impact the health and wellness of the people you're serving. So if you have a more complex project, you might need to get a trained evaluator, and you also have resources. So reach out to the UIHI for consultation if you need. They can likely help you find the right resources, and I'm sure you all have a number of TA contacts that could help you with some of these things. Here's my contact information. And Alex's, please feel free to contact us if you have any questions about this particular webinar. And I've really enjoyed presenting, and we'll go ahead and take any questions that you might have.
Well, thank you so much, Dr. Bartgis. That was an excellent and really thorough presentation. You covered a lot of important topics in a short time, so thank you very much. So if you want to submit questions, you can do so using the chat feature, or you can use the little raise hand icon, and I can unmute you so you can ask a question of Dr. Bartgis. We do have one question asking if we could go back to the qualitative data analysis and give a little more description of how you take the text or the audio recordings of qualitative data and code that, kind of a little more general, how you take that information and turn it into a code.
Oh, okay, I see. So typically what happens, let's say that you're going to do a focus group, and you have maybe 6 or 7 participants in that focus group. A lot of communities will audio record that, of course, with permissions from the participants. You would audio record that, turn that into a transcript, and then from that transcript, literally the coders go through every single line on that transcript, and they code that data according to some type of theme or sub-theme. Now, one of the things I think is really important is I'm a fan of using at least 3 qualitative coders for every data set, because if you've got 3 coders, if you've got disagreement, then at least you've got one person that can kind of help you come to consensus. Because there has to be some process of consensus if 2 coders disagree. And I think you saw that was one of the challenges with qualitative data is what if you've got 2 coders that disagree. So each coder has to go through and code that data, and then you have to compare your answers. Did you think it was workforce development and somebody else thought it was something else? How do you come to consensus on that? So that's kind of how you would take it literally from a focus group. You would turn it into a transcript, and you would have your trained coders literally going through every line in that transcript, and it's a very tedious process. The picture that you saw, the community folks that were analyzing qualitative data from focus groups and other things, it literally took them weeks, and the number of hours they spent was just incredible. So it is a pretty time-consuming process. And then as you're creating those themes, and you saw, if you could go back to that picture, can you go back to the picture of the community members that were coding data? And you'll see on the back of that photo, you'll see all the charts and things they have hanging up on the wall. As you're getting those themes and sub-themes, you have to have ways of organizing. Some use sticky notes, and you can see they've got sticky notes all over the place, as well as the themes. So you can see at the top, it's hard to see, but they're looking at barriers for accessing services. So we used what was called a grounded theory approach, and we really wanted to look at certain categories like barriers to services, access to care, quality of care, those kinds of things. And so they already had a framework that they were operating under, and then they went in and coded the data points based on their their overarching structure. And then within that, there became themes and sub-themes. You know, themes related to barriers for services, themes related to access for care, themes related to quality of care, those kinds of things. Does that make sense?
Yes, thank you very much. Any other questions? Again, you can use the chat feature or raise your hand in the chat function and I can unmute you. While you're thinking of your questions, I'll just do a few housekeeping things. When you close out of this webinar, a survey will come up on your screen. It's a very brief survey that will just help us understand how well this webinar reached the learning objectives that Jami outlined at the beginning. And that helps us improve future webinars and know what we need to tweak as we continue to make more products. And Jami has mentioned the resource guide, and if you when you logged into the webinar, entered your email address, we'll go ahead and email that out to everyone in the group so that you can have access to all the resources that were put together for all the topics that were covered today. So I'm not seeing any more questions come in at this time. Any other questions out there before we disconnect? The webinar slides and resource guide will be available on the UIHI website as well. Those should be up by tomorrow. Well, thank you so much, everyone, for joining us today. And thank you, Dr. Bartgis, for providing us this really important information. And again, I'll bring up the side here with contact information for follow-up questions on this webinar. And you can also, of course, always contact, oops, I went too far. The last slide here is the Urban Indian Health Institute's information, so feel free to contact us with any questions regarding evaluation process. Oh, we did get a question that came in. So the question is, has anyone ever pushed back against process evaluation? So maybe organizational or participant resistance to evaluation.
Yeah, I've never myself had that experience. I've heard of that before, but I use such a community-based and participatory model that it's a very kind and friendly version of conducting evaluation, and the entire focus of the evaluation is to support growth and improvement, and the data has to be used in that spirit. So it's not used to, you know, put any one person down or put any one staff person down, and it's really important that as the evaluator that I keep that in the forefront and make sure that when I'm writing up findings that it's in the spirit of growth and not placing blame. So I use a different model that probably is just much more friendly, not just for Native communities, but probably for anybody. So I haven't personally had that experience.
So you mentioned specifically community participation. Are there other steps you take at the outset to help develop that relationship and lay the groundwork for success in the evaluation process?
Yeah. The other piece I would say is that it requires ongoing open dialogue and communication. So as findings are coming in, I don't wait till I write a report to give the feedback to the staff. I do it pretty quickly. So that helps because if you wait till the end and you're not giving ongoing feedback for quality improvement, then it'll look like, you know, there's all this stuff that they didn't do at the end, when if I give them feedback immediately, then they have the chance to immediately make corrections, which they often do. So then when I'm writing the report, I'm like, throughout the process they learned, here's the things they need to do, here's the CQI stuff they did to improve what they were doing, and then I can really highlight their work in growth and improvement of the program. So you really have to have a good, strong relationship with folks. It's got to be honest and open. It's got to be focused on growth and health. And, there needs to be a continuous feedback loop between the evaluator that's collecting that process data and the staff that are implementing the program so that they have all the tools and information they need for growth. And I think it could be challenging if you waited to the very end and let's say I produced an annual evaluation. I gave them no information throughout the year and then just highlight all these problems without, allowing them an opportunity to continue to address those as they're moving forward. So for process evaluation, it's a unique form of evaluation, but you do have to walk lightly with it and make sure you've got strong relationships with the staff and that you're open and honest and giving that feedback as quickly and as timely as possible to support their efforts.
Thank you. We haven't had any more questions come in, so I'm just going to thank you all again so much for taking the time out of your day to join us. The slides and resource packets will be available on the UIHI website, and we'll also email it to participants that entered their email upon registering for today. Please do just take a few moments to complete the survey that will pop up. It's really helpful for us. It is anonymous and should only take a few minutes. And thank you again so much to Dr. Bartgis for leading today's session.
Sure. Thank you for the opportunity. It was great. Thanks.